For sure, grinding can be exacerbated by stress levels, but grinding is not caused by stress. There is always an underlying reason for the grinding, and usually it's actually associated with sleep disorders. And if I could just briefly explain how this works, is when you go into different sleep patterns, if the body perceives that there is an airway issue, as in we are not able to breathe as well as we should do, then there is a reflex that causes this muscle contraction, which then helps to open up the airway. So this is the byproduct of the body trying to almost save itself. So you get this grinding and clenching action that happens as a result of an airway issue. So that's how they're really closely related. And therefore, anyone who comes to me saying they grind or clench, I will always be screening them for a sleep disorder. Okay, so we have a lot of young ladies who come in, and they come in with acute facial pain. So either locked jaw, or they wake up in the morning with migraines and headaches, or facial pain, head and neck area pain. And that's always related, or it is related to grinding and clenching. So what happens then is that it happens for a period of time, but women have protective qualities of estrogen running through their body, and those receptors that are in the airway pathways, the estrogen actually is protective of that. But what happens then is when they reach menopause and the protectiveness of the estrogen drops off, you'll find that a lot of those ladies will end up with full-blown sleep apnea. So that's why many young ladies will come in, they'll say, oh, I used to grind, but I don't anymore. And that's just because those protective mechanisms have kicked in and made them feel better. They still need to be investigated, yes. You certainly can, and yes, there are injectables such as Botox that have been used on the market, and for sure it does give you relief, but temporary. Again, this is a treatment that's been offered to target the symptoms, but it's not targeting the cause of the problem. So my philosophies are always, please target the cause of the problem, work from there, and then work outwards, because just treating the symptoms, you're going to be revisiting that same problem over and over again. Whereas if you get to the cause of it and work on the cause, then it's a lifelong treatment that you've actually offered.